As escalating violence across the South Sudan, Ethiopia border drives thousands to flee, Médecins Sans Frontières, MSF, has relocated its operations deeper into Ethiopia's Gambella region to respond to a growing humanitarian emergency. The dual crisis, a surging cholera outbreak and mass refugee displacement, has overwhelmed local infrastructure and sparked urgent calls for international support. Fighting between the South Sudan People's Defense Forces and opposition groups in South Sudan's Upper Nile and Jonglei states has forced thousands of civilians to flee to Ethiopia. Many initially sought refuge in the border town of Burbeiye, but were forced to relocate again following renewed cross-border clashes, including a May 12th attack that left several wounded. Burbeiye has become critically dangerous, said Joshua Eckley, MSF's head of mission for Ethiopia. With thousands fleeing in a single night, we had no choice but to move with the people to where the need is greatest. MSF has since established services in Mattar, where the majority of displaced people have settled, many sheltering in schools or makeshift camps. Teams are addressing the medical needs of newly arrived refugees and responding to a cholera outbreak that has affected hundreds in the region. Over the past month, MSF treated more than 1,200 cholera patients and conducted over 3,000 outpatient consultations in Burbeiye alone. Since February, their facilities have treated over 200 war-wounded individuals. With the latest surge in violence, 9 additional injured people arrived at MSF clinics on May 12th. Refugees arriving in Mattar report harrowing journeys. We moved through villages with no clinics, no medicine, not even water, said Nael, a mother who lost contact with several of her children amid the chaos. When the bombs started falling, everyone ran. The humanitarian situation in Mattar is now critical. Estimates suggest between 35,000 and 85,000 people have arrived, most lacking access to clean water, food, or shelter. Nearly half of malaria tests conducted are returning positive, while malnutrition rates among children under 5 and pregnant women are rising at alarming rates. MSF's current response includes providing primary health care, nutrition screening, mental health support, and care for survivors of sexual and gender-based violence. However, aid workers warn that available resources fall far short of the scale of the crisis. We need immediate action from donors, the UN and NGO partners, said Eckley. These people are not just fleeing violence, they're escaping the collapse of every system meant to protect them. MSF is calling on all parties to guarantee safe humanitarian access and to protect civilians and aid workers. The organization urges international donors and humanitarian institutions to rapidly scale up their response, particularly in Mattar, where overcrowding and limited sanitation risk fueling further disease outbreaks.